Hi friends, welcome back to my channel Sharing Simple Knowledge. Today I'm here with another case note. Let's read the case note first. You are a registered nurse at Pullman Medical Center. Miss Paula Anderson is a patient in your care who is being transferred to Holy Heart Hospital today for a colostomy scheduled on 5/2/2018. Next is given patient name Miss Paula Anderson. Today's date is 2/2/2018. Date of birth is given. Marital status married. Social background lives with the husband, very supportive, and one daughter lives in the state. Then two sisters live nearby. Retired school teacher, English. Hobbies playing badminton, watching movies, like socializing, playing chess. Sedentary lifestyle, overweight since 30s. Medical background is given. Appendectomy 2003, fracture left leg 2007, pneumonia 2015, arthritis in hands, uses Voltaren. Then the diet pattern is written: red meat, processed meat, fast food, alcohol, vodka, wine 4 to 5 days per week, ex-smoker, quit 15 years ago. Next is nursing notes. On 28/12/2017, visit to GP 223, bleeding from rectum, rectal exam, definitely palpable mass, fast track referral for suspected colorectal cancer. Then 11th January 2018, 8 cm mass on left lateral wall of rectum, likely to be carcinoma, referred for colonoscopy. Then 14/1/2018, colonoscopy, biopsies large bowel mucosa taken. 18 January 2018, CT and local staging of primary tumor with MRI. Then 23/1/2018, review of histology, colonoscopy report, diagnosis colon cancer. Review by colorectal and general surgery consultant. CT, no evidence of metastatic cancer. Recommended colostomy. Patient advised of diagnosis and surgery. Then next, identified needs problems. Prepare for colostomy. Eating and drinking, potential problems of dehydration due to above. Anxious about problems of stoma on home and social life. Involve family members in care. Then objectives: minimize risk of post-op wound infection from bowel contents. Allow surgeons clear access to operation site that is free from fixes. Complete pre-op care schedule. Encourage patient to voice concerns. Then plan rectal washout before bedtime for 3 days daily. Purgatives as desired. Low residue diet on 2nd February, that is today. Fluids only including soup and ice cream on tomorrow. Then clear fluid on 2/4, that is 4/2, not 2/4. Charge nurse to see patient to discuss practical problems at home. Nil by mouth from midnight hours on 5/2. Standard pre-op procedure. Then ensure variety of acceptable drinks. Let's move on to the writing task. Using the information given in the case notes, write a letter to Miss Meredith Stevens, charge nurse, Holy Heart Hospital, 119 Red Sparrow Road, Docklands, Melbourne, outlining relevant findings and patient care plan to prepare Miss Anderson for the surgery. So we know what is the requirement they are asking, the preparation for the surgery. So from this case note, we have to see what all relevant information we have to include in this letter. I am going to show you one letter of my student and how we can correct that letter. So let's see. The address is given, it's correct, but we should be careful when we are writing capital letter, small letter. Then Miss Paula Anderson, date of birth is written. Then how is the introduction? This letter is to introduce Miss Paula Anderson, who has been diagnosed with colon cancer. It's okay. Then there is a Miss Stacy. The gender is female and she wrote, he requests, this is a big mistake, they will reduce your score. He requests further care and management from your facility for a colostomy surgery which is scheduled on 5/2/2018 after being discharged today. Here also they are asking only for the preparation. not for further care or management like that. So we have to mention only that one. And the mistake here, to being discharged, that is should be past participle ed, and this is a mistake. So how we can correct it? I am writing to refer, or this the letter is to introduce Miss Paula Anderson, who has been diagnosed with colon cancer and is being transferred to your facility today for colostomy after 3 days, or we can mention the date 5 to 2000. Then she has written on 28 to 2017, Miss Anderson presented with rectal bleeding. On examination, palpable mass is noted. Thereby, she referred to fast track for the diagnosis. Investigations were carried out, and Miss Anderson has been diagnosed with colon cancer. She also being suffered from arthritis, for which she is on Voltaren. Here, what you have seen, the fast track, that is a fast track referral done, that is only mentioned. So, and investigations were carried on colon cancer. It was already mentioned in the introduction, so it is redundant. Then the arthritis, being no, this she has arthritis, there is no importance in this case, so no need to mention about it. How we can rewrite it? Miss Anderson's symptom was first noticed on 28 December 2017 as bleeding per rectum. She was referred for colonoscopy along with biopsy to confirm the diagnosis. Since there was no evidence of metastasis, she has been advised for colostomy. That's enough, just concise, no need to mention one by one. Following the diagnosis, Miss Anderson was consulted by colorectal and general surgery, and she was recommended to undergo colostomy. So it is important to prepare Miss Anderson for the surgery. The rectal washout to be done for 3 days before bedtime. Purgatives as needed. Fluids need to be started 2 days prior surgery, including soup and ice cream, followed by use clear liquids on the day before surgery. Please keep her nil by mouth on the day of the surgery. Please ensure variety of acceptable drinks as she is dehydrated. From this paragraph, there are so many inaccurate sentences, and the meaning here it's mentioned. No need to mention about the colorectal general surgery referred like that, undergo colostomy. It's already we can concise and tell before we already mentioned. Then it is important to instead of writing like this, we can make it more clear and concise. And in the last, please ensure variety of acceptable drinks as she is dehydrated. But it's in the case note, it's saying that to prevent the potential dehydration. So just a plan only. Actually, she's not dehydrated. Be careful whenever you are reading the case note and try to understand the notes in a proper way. If we misunderstood something, it can, and if we write in a different way, it will affect our score because the meaning will be different. So how we can rewrite it? Regarding the preparation, she is advised to consume a low residue diet today, followed by liquids on the following days. However, it is important to keep her nothing per oral from midnight on the day of the surgery. Please ensure a variety of acceptable drinks to prevent potential dehydration. Let's move on to the recommendation paragraph which she has written. Considering the above, it would be appreciated if you could provide better care and support for Miss Anderson. It is important to visit Miss Anderson and involve her family members to discuss about the post-operative care and problems at home, and also allow her to express her concerns. If not, please allow surgeon to keep clear access to empty the fecal content in order to prevent infection. So please do let me know if you have any queries. From here, what all mistake we can see me. So it would be appreciated if you could provide better care and support for Miss Anderson. Actually, the care we are not asking, so what we have to mention about the preparation and the prevention of complication like that. and it is important to visit we can mention that, but first we have to give the emphasis for the preparation for post-operative care and problems at home, and also allow her to express her concerns. Here is several times you use and also that same meaning, so don't use together. Then please allow surgeon to keep clear access to empty the field. That is a wrong sentence. We should be careful. We are writing to avoid any grammatical mistake. That's why we encourage to do the proofreading at last to prevent these all errors. Then please do let me know if you have any queries. Then how we can write in a better way. Let's see. In order to reduce post-operative complications, including wound infection, as well as to allow surgeons a clear access, a daily rectal washout before bedtime is necessary for 3 days. Laxatives can be used as desired. Then, if the word count is less, we can include Miss Anderson is a retired school teacher and lives with her husband, who is very supportive, and she prefers to eat meat items and fast food. That is not important. This is only semi-relevant. But if in case you cannot achieve the target word count, you can just include. And the recommendation we can write, it would be appreciated if you could discuss practical issues at home because she is concerned about stoma and its effect on her social life. Please clarify her doubts and encourage the family members to take part in the care of Miss Anderson. Please do not hesitate to contact me if you have any queries. Yours sincerely, Registered Nurse. So always try to avoid copying the same words from the case note. Try to paraphrase it or use the synonyms in order to get more score for your writing task. I think it's clear for you, and if you have any doubts, you can comment below the comment box and try to write your own way. Don't copy the same thing what I have explained. It makes you more confident. Thank you. In order to understand clearly, you have to watch without skipping. And one more thing, try to listen to more English channels rather than listen to our native language, because I can see more views for our native language channels, because you should come out from your comfort zone. You should try to improve your listening skills or vocabulary. In order to that, you have to listen to more English channels. Thank you. Bye.